Thank you, Ian, and good morning, colleagues. First of all, I would like to acknowledge the traditional owners of the land from which I am joining today's event and pay my respects to their elders, past, present, and emerging, and any Aboriginal colleagues joining us today. I would also like to thank the Royal Society for the privilege of addressing this annual forum and representing New South Wales Health in this important discussion about the future. Our digital child is born in New South Wales today is likely to be born to a mother aged between 30 and 34. And there is a 1 in 3 chance that it will be born to a mother who was herself not born in Australia. We have a very high likelihood, more than 90%, of having a normal birth weight and will stay in hospital for 2 to 3 days prior to going home. Relative to the rest of the world, this child will be very fortunate to be born in Australia, a developed country with one of the world's best health systems. It will have a life expectancy of 85 years if it's a girl and 81 years if it's a boy. However, if Indigenous, this child's life expectancy will be around 8 years less than of its non-Indigenous counterpart. New South Wales Health, sorry about that. New South Wales Health, like other organisations in our health system, is committed to ensuring that a child born today is on the way to a long and healthy life. For our children to thrive, we need to support their development and learning from conception onwards. This will improve their health and well-being in the present, but also into the future, giving them longer and healthier lives. This is the essence of New South Wales Health's first 2,000 days strategy. The first 2,000 days of life, from conception to the age of 5, is a critical time for physical, cognitive, social, and emotional health. Early life experiences during this time will determine whether a child is more likely or less likely to experience good health and well-being into adulthood. A child's development score at just 22 months can serve as an accurate predictor for their educational outcomes at 26 years of age. The first 2,000 days is crucial, and this strategy recognizes the power of technology as its key enabler. Digital technology already underpins the delivery of services, and it provides us with the data to understand if we are delivering the services that families and children need to have the best start in life. In recent times, we have seen an increased uptake of virtual care and telehealth, making a tangible difference. For instance, virtual allied healthcare complements face-to-face care and assists in situations where there are access issues for families because of the long distances they have to travel. As part of a blended model of care where selected appointments are face-to-face, virtual appointments can reduce stress and barriers to accessing regular appointments. In some parts of the state, this is already a reality. Outcomes that will predict our digital child's health journey started before they were born. And this is why it is important that a digital health record commences before a child is born. This is why New South Wales Health has led the National Digital Child Health Collaborative that harmonised all the jurisdictional paper-based pregnancy and child health records into one single digital health record. The ability for health information systems to share data lies in common terminology, clinical information modelling, and standardized technical language. We now have all these ingredients in place to enable real-time interactive sharing of data centered around children and their families. This digitized child health record is a starting point for a lifelong digital health record, which will follow and serve this person throughout their lifetime. By 2030, when our digital child is a school child, it will not only have a comprehensive digital health record that both the child and its parents will be able to use on their very smartphones, but this record is likely to also include genomic data. It is very likely that health and genomic data will be combined with relevant information from education and social services, making it possible to predict, diagnose, and treat various health or developmental problems more precisely and personally than ever before. The child and their family will be accessing many of the routine healthcare services virtually from the comfort of their home, and their interactions with the health system might be primarily through digital channels. AI-driven care navigators will assist the family with their healthcare choices and suggest the best ways for them to meet their needs. And if this includes, for example, a visit to a hospital emergency department, their arrival will be anticipated, and they will be greeted by clinical staff who are already familiar with the child's circumstances and the relevant healthcare history. Digital channels of communication between healthcare providers and the family will continue after their hospital episode, with information following the patient and proactive advice and support services being provided in the community. Wearable devices used by family members will be able to transmit biometric data, which will be analyzed in real time by autonomous machine learning algorithms and provide predictive and proactive advice to families and to their designated healthcare teams. The child and the family will interact with new kinds of healthcare workers and professionals who will be equipped with advanced digital tools, such as AI-driven decision support systems and real-time analytics. Training and development of healthcare professionals is likely to evolve towards more cross-disciplinary approaches, with deeper inclusion of technology-related and data analytics subjects in the training curriculum. This might be combined with stronger infusion of customer service and customer experience skills, as well as human-centered design and agile problem-solving methodologies. As a legacy of the pandemic era of the early 2020s, the health system is likely to be supported by strong population health and disease surveillance capabilities, as well as, hopefully, the sovereign vaccine manufacturing and distribution capacity. While many of these advances will improve health outcomes and the safety and quality of care, there will be an ongoing debate about ethical issues surrounding the use and sharing of personal health information, especially genomic data and device-generated data. The meaning of patient consent and how to give it effect might be of great interest. Significant concerns are likely to be raised about the issue of digital divide, which might result in greater health inequalities if it is left unaddressed. Quite simply, one's health outcomes may depend on that person's ability to access digital services and interact with them. By 2050, our digital child will be entering the fourth decade of its life. Hopefully, they will live in a world where climate change has been put under some kind of control and where global geopolitical fault lines are not as deep as the ones we are witnessing currently. If this optimistic scenario becomes a reality, it is likely that this person will benefit from the many biomedical and technological advances made in the previous 3 decades. While this person is likely to be in good health themselves, they are likely to have access, if needed, to gene therapy, robotic technology, nanotechnology, bionics, and bioartificial organs. Digital technology, which was prominent in previous decades, will be considered mature or even old technology. Artificial intelligence is likely to be a mainstay of healthcare, with many routine tasks and activities delegated to autonomous AI agents. Ethical questions related to human-machine interfaces, end-of-life issues, and global health inequalities might become very significant. Impacts on health workforce are difficult to predict in this scenario. It is likely that AI and robotics will replace some types of healthcare workers, or at least reduce the demand for their skills. But other types of healthcare workers might gain prominence in areas requiring creativity, as well as humanistic, compassionate care, and ethical decision-making. And of course, there will be a myriad technical roles required to design and oversee the healthcare technology, which might be widely deployed to support provision of care to an increasingly aging population. Machines will become an integral part of a patient's care team. While it is hard to predict what the health of our digital child might be influenced by in 2050, we do know what will determine many of their health outcomes right now, and that is the child's first 2,000 days. For our children to thrive, we need to make sure that they have access to all the services they need at the time they need them, which is as early as possible. We need to support them to build not only digital literacy, but digital health literacy, so that they can be active participants in their healthcare. The New South Wales Government's Bright Beginnings initiative aims to give children the best start in life. So the good news is that we can make a massive difference to the future health of our digital child by taking the right policy decisions and making the right investments today. Thank you.
Thank you very much, Zoran. Thank you very much, Zoran. That is a very, very positive perspective of the future, and something that I'm delighted as a citizen of New South Wales to hear that come from someone in such a senior position in New South Wales Health. The next speaker is Professor Louisa Jorm, someone I've had the pleasure of working with over the last, let's say, 10 years, looking at the world of health and looking at the world of data. And so without further ado, Louisa, I hand to you.
Thanks so much, Ian. And again, thanks to the Royal Society for the invitation to speak today. I'd like to begin by acknowledging the traditional owners of the lands that we're all meeting from. In my case, it's the Gadigal people of the Eora Nation, and I'd like to pay my respects to their elders past and present, and to any Aboriginal people who are present online today. So I too will be talking about health of our digital child. But I wanted to begin by saying that the health of the child born today is going to be influenced by some very major environmental forces. And I think it's pretty timely today with COP26 going on in Glasgow to just remind us that the child born today is going to be living in a world where there's going to be rapid environmental degradation unless some big decisions are made now and some big changes are made now. And a reality of life for the child will potentially be living in a environment of poor air quality, increasing storms, weather events, major weather events, disasters, and as we've seen over the last couple of years, potentially pandemic events. So wearing a mask is probably going to be a day-to-day occurrence for our digital child. And there are already sort of growing bodies of evidence around the degree of digitisation, and in particular the use of personal mobile devices and impacting on child health. We've got increasing prevalence of child obesity, evidence that short-sightedness and other vision problems are increasing in prevalence in children and teenagers, and also very unfortunately some evidence that overuse or over-reliance on digital devices is actually resulting in changes in the social, emotional development of children and their well-being, and potentially resulting in increasing prevalence of a whole range of mental health problems. So there are some real challenges that we know are already facing our children today, that the child born today will also experience possibly even more intensely than our current generation of children. However, on the upside, technologies are offering many new ways to actually improve health and maintain health. Some sort of interesting examples include smart nappies that are now actually going into production, keeping our digital child nice and comfortable and notifying the parent's smartphone when there's something that needs to be changed. We've got smart bottles that can actually monitor a child's nutritional intake. And we have even smart dummies, which can monitor a child's temperature remotely, and that can be seen on the parent's phone. There's a whole plethora of these child-related digital technologies, health-related technologies that are now coming onto the market. But interestingly, when you Google these and look at these, so many of them are startups which are making big claims, and there aren't necessarily all that many that have actually made it into real-world implementation and production yet, but undoubtedly they will over the next 20 to 30 years. I think also the child born today will, over the next 10 to 20 years, actually become accompanied by a personal health avatar. In health, there's a bit of a debate about whether you call this a personal health avatar or a digital twin. There seems to be consensus at the moment that what we can do with existing health data will not really provide the sort of detail that would make this a true digital twin. So a personal health avatar is what we're sort of calling it in health and medicine at the moment. But basically, this is something that will accompany the child and will bring together its records from a whole range of different sources and basically simulate it as a human being and simulate its responses to health-related interventions. We already have the very beginnings of this in our electronic personally controlled health record, My Health Record, but over the next 10 to 20 years, the amount of data that are held in those records from a whole range of sources is going to become just richer, so much richer. Zoran already mentioned genomics information. We'll also be bringing in sensor information, social media information, information from wearables and sensors, and information from all components of the health system. They're currently quite difficult to bring together across sectors. Having such a digital avatar will enable personalised treatments to be developed for the child, but will also potentially allow treatments to be tested out or simulated on the child before they're actually put into practice, potentially resulting in much better targeting of expensive or potentially harmful therapies and avoidance of safety issues with therapies. So the digital health avatar is it's sort of a new idea, but I'm quite confident that we'll have something probably resembling that by 2030. However, again, others have talked about some of the potential dark sides. Zoran mentioned the digital divide. This slide actually shows part of a campaign that's currently active in New Zealand, the Leave No One Behind campaign, which is trying to address digital exclusion. I think we are actively going to need to take this sort of initiative in Australia also. And not only is there a divide relating to whether or not people can access devices, have the money to pay for devices, or have the knowledge and skills to use them and to interact with them, there's also the potential for algorithmic bias in AI technologies. And a prime example of the potential for this is that around half of the current published scientific papers which apply machine learning to hospital-based electronic medical records actually use a single data set, which comes from a hospital in Boston in USA. And so a very, very large number of AI algorithms have been built using this one data set. And it comes from a population that looks nothing like the Australian population, obviously does not include any Indigenous Australians, and really does not include many of the other population groups who we have in Australia. There's a really urgent need for our own Australian electronic medical record data to be made much more available for research and for development of AI algorithms. And if we don't, we do have the potential to inadvertently implement things that may result in increasing inequalities and potentially harm for some members of the population who were not present in the training data that we used to develop an AI algorithm. And I think it's really important to remember that a machine learning algorithm, an AI algorithm, is only as good as the data that it's trained on, and basically it replicates the past, it replicates those data rather than being able to predict the future or adapt to individuals that were not present in that training data. But to end on a slightly more positive note, there is potential for these digital technologies to help address inequalities, and in particular, global health inequalities. This is an example that comes from, originally from Yale, but now implemented in Rajasthan in India, called Kushi Baby. And this is basically a near field communication tag, which is used to store compressed vaccine records in an offline and battery-free format. So basically the child is taking their health record with them in this lovely little tag around their neck. And in many ways, these sorts of technologies can allow countries that have been slower to have digital adoption, who are less wealthy, to in some ways leapfrog the world of paper-based records and complex electronic medical records that we have in Australia to far more personally controlled, low cost and effective sort of devices like this. So I guess to sum up, there's going to be a lot of challenges for our child, not least those relating to climate change and environmental degradation. There's going to be a lot of very exciting developments relating to technology and in particular AI. But the big thing that I think we'll really need to be asking the question in 2030 and in 2050, who's been left behind? Has anyone been left behind? Thanks very much.
Thank you, Louisa. Thank you very much for that. We already got some audience questions coming in. The first one's going to Zoran, and not surprisingly, the questions coming in still speak to the issue of data. Now, I'm very happy to say that health is a very sophisticated user of data. But the question, Zoran, is there a risk that use of likely historical data is going to make the outcome inevitable by shaping decisions to make or to assist in making decisions which lead to a self-fulfilling prophecy?
Well, I think Louisa already kind of answered the question when she alluded to some of those algorithmic biases. I think this would be an example of one of those. So I think we need to do everything we can to prevent, use of data in this way. What I tried to portray in my talk is that health. I think what's really important in health is that interaction between citizens, patients, consumers, and healthcare professionals. It is a human service, and I think it is really important that we don't lose that kind of humanity and the human judgment and proper ethical decision making from the whole process. Which is why I touched on the importance of workforce changes and workforce development in health. So I think it's data combined with appropriate judgment and the right types of process and interaction between clinicians and their patients that will hopefully prevent some of these biases from occurring. But it's a real risk.
Thanks, Zoran. So, Louisa, we've got a question which actually builds on part of your presentation. The question came in before you showed that example of the personally controlled health record. But if we wind forward and think about the richness of data, so diagnostic, genetic, behavioural, epigenetic data, how do you envisage the interplay between all of these different sorts of data about us and about our health and about our environment and the issue of self-sovereign identity in eHealth?
Yeah, it's a real double-edged sword, isn't it? The idea that we should control our data and consent to all the uses of our data. But then on the other side, if we don't have representative data about whole populations that include all members of that population, you could end up with biased algorithms. So how does one balance that? Obviously I'm someone who's a researcher who works with data. I feel very strongly that we don't actually make enough use of the data we already have. I believe that there are increasing ways that we can safeguard and protect privacy, but there's always going to be a risk of a privacy breach if large-scale individual records are being used, even in aggregated ways. So I guess it's a risk management framework that we have to work with. I do strongly believe that people should have a degree of control over the use of their data, and that we probably need far more dynamic ways of people being able to provide consent for specific uses of their data than they currently have. But on the other hand, I also think we're going to be in trouble unless we actually make our data more available and more openly accessible for research and development of algorithms. I think one interesting area is use of public sector data by private sector, and who should share in the benefits from that. And I think an earlier speaker mentioned the potential dollar value of data. And again, I feel very strongly that if data are being generated by public services in the public sector, any commercial returns on that data need to be thought about very carefully, and there needs to be a return to the public, both in terms of potentially health benefits, but also financial benefits.
Thanks, Louisa. We're down to our last 5 minutes, and there is a question I'm going to ask you which is similar to the other folks, but I didn't want to leave this question before I had Zoran a chance to ask you about the increasing richness, specificity, and personalisation of data, and that issue of actually having our self-sovereign identity in eHealth. And possibly I might ask you the question, I'm assuming that we'll work this out eventually. When do you think we will have sufficient control systems, processes in place so that we're not having this conversation anymore, but we're now focused on the use of the data as opposed to the concerns of the protections, or the concerns around protections of data?
You're probably one of the most qualified people to answer that question, Ian, but I'll try. I know that this is an area that you have been contributing to very constantly. Look, my view on that is that I hope the answer is soon, for reasons that Louisa already outlined. Like, you know, hopefully, certainly in the next few years. I see some positive signs. I think technology is offering us some options and opportunities, for instance, blockchain technology that could help with consent, digital consent. I think our governance processes are maturing, becoming more seamless and more permissive, but in a safe way, which I see as a positive way forward. What perhaps is still missing, I think, perhaps in the Australian context, is more engagement with the community. You know, a more open, honest conversation about the pros and the cons, the risks and the benefits, and what's okay and what's not, and how can we together as a community come up with the right balance, and discover the future together. I think that's perhaps an area that needs a bit more work and could go nicely with the issues of health literacy and digital health literacy that I touched on.
Great, thank you, Zoran. Now, Louisa, back to you. We've got only a few minutes left. I'm going to ask you, it's 2050. What is no longer an issue, and what are we spending our time discussing in the world of health?
I hope that data privacy is no longer an issue, and that we have actually developed those safeguards and that degree of social license that people feel comfortable with, you know, how their data are being used. I guess, what are we going to be discussing? We're going to be discussing, you know, what is the role of the health professional going forward? How much is done in an automated way? You know, already we're talking in our own medical school around, are we training the doctors of the future in the right way? They're going to be working in a very, very different environment. So I think the health system will look very, very different. I think health professionals will look different, and we'll be talking about ourselves really as being people who have much more control over our health and our healthcare.
Thank you, Louisa. Zoran, same question to you. What is no longer an issue, and what are we really focused on?
What is no longer an issue? Well, I would agree with Louisa. I hope that this whole issue around privacy and confidentiality and how we use data is something that we overcome very soon.
And what are we really focused on, discussions?
Inequalities, the issues of digital divide, and similar framing that Louisa offered, that worries me a lot. I think both in terms of Australia as a nation, but then over time globally, I think that will become a pretty big issue.
Wonderful, fantastic. Louisa and Zoran, thank you very much for your contributions today. Thank you for digging deep and projecting forward to the world of 2050 and beyond.